Hello, and welcome to another Pipe at Pearl. Today's Pearl, we're going to be talking about the self-testicular examination. It's a very important test or process that all men should go through during most of their lifespan. However, it doesn't get a lot of attention, and it certainly isn't talked about as much as it should be. So today the goal is obviously to talk about the associated risk factors of testicular cancer, highlight the age groups that are most at risk, talk about the actual true signs and symptoms of somebody with testicular cancer, talk about the process of examination and how often it should occur, and what should occur if you find an abnormality in the testicles. And then we'll also talk about what else it could be, because not all lumps and abnormalities found in the testicles are cancer. So we'll start this process off, hopefully build some conversations, to build greater awareness around the importance of the self-testicular examination. So starting with the risks. The big risk profile is quite young ages. Okay, compared to other cancers, testicular cancer is the leading cause of cancer in men in the age group between 15 and 45. Now, having said that, you're at significantly higher risk of testicular cancer between the ages of 20 and 34, but we'll break down the epidemiology a bit more as we go on. Some of the greatest risks that have been found right back in the early 1950s was cryptorchidism, which is a process during development where the testicle fails to descend or descends late. Now, this leads to problems with spermatogenesis and also can affect the actual sexual characteristics of development during puberty. And what they find is that and also that linked with maternity-based heightened levels of estrogen can lead to greater risks of testicular cancer. There is a strong risk associated with family history, actually a much stronger risk. We're talking 6 to 10-fold greater with a family history compared to 2 to 4-fold with cryptorchidism. Certain infections like female cervical cancer can also lead to testicular cancer, and they include HPV, Epstein-Barr virus, HIV, and there's also cryomegalioviruses and certain parainfluenzas as well. Testicular trauma, as you would have heard about, breast trauma, testicular trauma is also another way. If you have repeated hits to the testicles, it does seem to require the body to go through cellular adaptation and regeneration, which just increases the probability of genetic malformations during this reconstructive phases. Obviously, if you've had history of testicular cancer, then you're more likely to get it again. And in modern times, they've found a huge link with genetic factors. And the more genetic research they do, the greater links they're finding with genetic factors in causing testicular cancer, which means hopefully one day that we'll be able to screen for probabilities and then get it as early as possible, because it is one of those cancers that have a really high survival rate if identified early. We're talking 90% survival rate and 95% survival rate up to the 5-year mark from early identification. The earlier it can be found, the greater the survival rates are. So looking closer at the breakdown, the highest incidences around the world is found in Western and Central Europe, and that's where the rate is around that 8 in 100,000 men. Okay, so it doesn't seem like a lot, but it's a lot for the individuals that are actually getting it. The breakdown age, as mentioned, 20 to 34-year-olds constitute 51% of all cases. Then you have 23% from 35 to 45, and then anything outside of that age bracket, you've pretty much got a 13% chance from 15 all the way up to realistically 55 and beyond. Beyond 55, it's very, very, very rare. However, under the age of 15 is also excessively rare. The signs and symptoms that you'll find is obviously comes across as a misnomer, and there's a lot of assumptions out there that people throw around that aren't exactly true. So the biggest clinical signs the patient feels prior to testing is they feel a heavy or uneven scrotum. It's often unilateral lumps that are cancerous. So as a result of that, it's an increase in mass, therefore it feels heavier and it hangs a little bit uneven as well. The misnomer that there's no pain associated with cancer is not exactly true. It is very common for the patient to get abdominal pain and back pain, and 30% of the time, or 1/3 to be exact, of all patients with testicular cancer will actually feel a dull chronic pain associated with testicular cancer, and 10% of them can actually get acute sharp pain associated with the cancer. Okay, so it's not even close to a guarantee of painless lumps being cancerous. Another thing that can occur is enlarged breast tissue. This occurs as a result of the reduction in testosterone production, which obviously allows estrogen to be comparatively higher in level, which results in breast tissue or gynecomastia production. And then on palpation, you will usually find a unilateral lump or swelling on it. So there's the signs in the background of the actual testicular cancer. So let's talk about the technique that we tell our patients to undertake. So it is always best to have a routine and get familiar with the testicles. So always tell the patient that if they haven't felt their testicles before or regularly, then they need to know what normal feels like, and they need to have a base rate to do it. It is always recommended that you start in a warm environment. They often recommend a bath or a shower that you check the testicles, but it can also be in a warm bed. However, allowing gravity to have the testicles hang is often better than lying down. You are to gently cup each testicle one at a time, and then you are to examine gently, rolling your thumb and finger around the testicle. Now, looking at a lot of the recommendations out there, people that don't really know testicles can get a bit of a warped understanding of how large the male testicles generally are. So generally speaking, for people that don't know, the size of the testicle is around 20 to 30 mils. Now, what that equates to is a 4 by 3 by 2 centimeter egg shape. However, they can get slightly different shapes. So it is not large enough, as the picture's denoting, to have two full hands coupling it like it's a cricket ball. Okay, if it is, then you probably should have been checked out earlier. This is just denoting the importance of feeling all the surfaces. Okay, so don't let the males feel like they have an inferior size scrotum, and don't set expectations of having cricket ball sized testicles to palpate when providing this information. The important thing is they should be completely smooth to touch. Now, it can be quite sensitive to do so, and people can feel quite nauseated as a result of even gentle palpation, so just warn the patient out on that. But they need to be aware of where the testicle is, where the spermatic cord and the epididymis lies, so that they know if they feel vasculature or things that feel a little bit like masses, that it may in fact just be the vessels that are connected to the testicles. What they're trying to find is lumps or changes in size or irregularities. As they're moving across the smooth surface of the testicle, it extends down into a less than uniform mass or a divot, a lump, anything that is abnormal. That is all they need to find. They don't need to diagnose it or anything from there, nor should you. It doesn't automatically mean cancer, but it means that it warrants a checkup for an ultrasound to really denote what sort of lesion it is. There are a number of other things that it can be besides just a lump. And even if it is a lump, there's a bunch of other things that it can be besides cancerous. So we have things like hydrocele, we have epididymitis, we have orchitis, which is inflammation or infection of the epididymis or the testicle itself. You can even have epididymal cysts, varices, and then of course you can have cancers. But on top of this, you can also have herniation of bowel that goes into the testicle, which will feel completely different to the testicle, but it's also not cancerous. So just let the patient know that there are a number of things out there that it can be, and just because an abnormality is found in the testicle does not automatically mean that it is cancerous. So recommendations moving forward. You provided the patient with sound advice, and now the hard part is to get them put into a routine. Now, monthly is the recommendation, but I was very surprised to find the absence of apps and texting services and things like that within Australia, as is found in other countries like America. You will find a number of organizations in America that will create databases that will send monthly text message reminders to patients in order to track and keep on top of their testicular checks. You'll also find handy apps that allow people to note down what is found, a routine, almost keep a diary of what is different, what is found, instructional videos, all sorts of things out there, but Australia seems to have none at the moment. So things you can do is you can get them to set a calendar reminder on their phone, on their device, whatever it is. You can also get them to include their partner if they're comfortable in doing so. So then the partner can help remind them of the importance of checking for testicular changes and lumps. And if you're out there and you're listening and you're quite technically savvy and clever, then maybe you could be part of the change that brings in a texting service or an app to further help Aussie males in the early identification of testicular cancer. Okay, that brings us to the end of self-examination of the testicles. I hope I've illustrated the importance and risk profiles associated with testicular cancer. It doesn't take a lot to increase your risk associated with testicular cancer. An active person playing sport can be at risk of testicular cancer. And unlike other cancers, it seems to affect people when they are quite young and maybe have the perception of bulletproof and therefore not really interested in monthly checks. So as clinicians, it's really in your interest to educate all males on the importance of testicle examination and do your part in increasing the conversation around self-testicular examination. But until next time, take care.